Recently, Hologic launched its Global Women's Health Index. It's a study that looked into the health of more than 3.9 billion women and girls. Now, the index found Australia ranked in the top 10 countries globally, scoring 64 out of 100. And that's pretty good considering no one country scored more than 69 out of that 100. Now, the study also highlighted gaps in women's screening and preventative care, and while diving deeper into mental health and safety. Now, Hologic is calling for a greater collaboration on global healthcare, leveraging the index's data and insights to actually guide the development of actionable and measurable plans and investments that prioritise women's health effectively, both here in Australia and around the world. And joining us to discuss Hologic's Global Women's Health Index and its findings is its Director of Marketing, Aggie Cox. Welcome, Aggie.
Thank you, Michael. Thank you for having me.
Now, the Hologic Women's Health Index, what was its overall finding and how long did the study actually run for?
So the first year study was collected in early 2020, and particularly for Australia, it was collected through February and March of 2020. So it was just as the pandemic was starting here. And the three key findings were that Australian women were falling short of meeting guidelines around cancer and STI screening. Australian women were also more likely than men to report feeling stressed and sad for much of the previous day. And nearly 9 out of 10 Australian women see domestic violence as a widespread problem.
It's horrific and endemic at the moment. The reporting is constant as it is heartbreaking. Now, you mentioned the cancer screenings that have gone wayward. How long will it take us to make up for that? And will there be a flow-on effect, do you think, of worse than, great outcomes given that delay in screening?
Yeah, I think that's a really great question, and I think what is currently being reported is that we do expect there will be some flow-on effect, and I think there are a number of organisations and government who are working now to create that awareness and try and get people to catch up on their, put their health, make their health a priority, and try and catch up on their screenings, so we can kind of get back on track, and that the impacts of the recent pandemic can be a little lowered.
Now, I noticed in the report that it's roughly 50% of women between the ages of 45 and 75 are meant to get screening, and that actually dropped down to 35%. Is that right?
Yes, that is correct. Wow. So in our data, and I know that, as we continue, this being a multi-year study, we are anticipating that yes, those results from COVID will be lessened as well.
Now, here in Victoria, we've just had our budget announced, and it was a huge one for health. We've seen our health system in a pretty dire strait, everything from the quality of our O response through to emergency waiting, through to problems getting primary care in GPs. How satisfied are Australians with the quality and the availability of healthcare in their area?
So at the time of collection of this data back in early 2020, 83% of Australians were said to be satisfied with the availability of healthcare in their area. The median satisfaction level was 77% amongst 43 of the high income countries. Australian women are about as likely as men to be satisfied. That was 82% versus 84%. Although it should be noted that the satisfaction was lowest amongst the low-income population, which was at 76%. We are fortunate, in Australia that we do have great preventive care programs in place to help monitor, breast, cervical, and bowel cancer, as well as heart disease and diabetes. But we need to continue to encourage Australians to make health their priority, and as we discussed, especially post-COVID, to catch up on their testing and their health checks.
Now, I read a frightening report from a GP friend of mine, and she actually asked the question, what is the most predictive stat for health outcomes, whether it would be poor diet, lack of exercise, smoking, family history, and it was none of those. It was actually postcode at birth. So are Australians doing a good enough job of having access to that socio-economic, that lower strata of our society?
I think the data in our survey definitely show that there's work to be done with those groups, that we do need to make health more accessible for, lower socioeconomic areas as well as rural areas and Indigenous areas. So that's one area that, we definitely have more work to do.
Right. And how critical is gender-specific data and the collection of it to actually understand the needs of girls and gender-diverse people living in Australia, and in identifying any gaps and outliers?
What we don't measure, we can't improve. So, data is a great catalyst for action, and healthy women are the cornerstone of families, communities, and societies. So to have that benchmarking data is really critical in understanding where we need to direct our attention, so that we can make, the necessary improvements and, have a positive impact on the quality of life and the life expectancy of women, in Australia and across the globe.
Now, the Fantastic Index provides an actionable and science-backed data roadmap for improving life expectancy and, more importantly, quality, because who wants to live longer if you're not living well, for women and girls worldwide? And it was developed in partnership with a leading analytics and advice firm, Gallup. Now, has anything like this been done in this depth before?
No, this is actually, which is very exciting for us. It is a first globally comparative study on women's health, and the findings cover more than 90% of the population. So until now, there has been no single measure that was directly based on the lived experiences of women and girls to capture and compare the overall state of women's health by country and by territory. And it looks specifically at 5 dimensions around basic needs, opinions on health and safety, individual health, preventive care and emotional health, to be able to assess that life expectancy.
Right. Now, do you think that this index will provide a guide for actual policy decisions and initiatives at a government level or a global level? Is that what you were looking to achieve from the study?
Yeah, I think that, it's definitely our hope, and, different countries have different needs. In Australia, it was great to see that our findings were aligned with the focus of the National Women's Health Strategy, and we hope that this multi-year data can assist in evaluating how the strategy is progressing. The primary purpose of the index was to generate that valuable data to be able to raise awareness, start conversations, encourage collaboration, and certainly to be a call to action inside and outside of government with corporates and advocacy groups to elevate and spotlight women's health.
Great. And as you said, this was pre-pandemic, so a lot of things have changed, and I would assume none of them have changed for the better with this cessation of hospital visits, doctors visits, scanning that we mentioned, all the rest of it. Does Holorific expect to do another survey, and if so, when?
Yes, so we have undertaken, so COVID slowed things down a little bit, but we have undertaken the year 2 surveys at the end of 2021 and the start of 2022. So the second iteration of the results will actually be launched. The initial global findings will be launched and shared at the World Economic Forum later this month in Davos. And our initial study was conducted across 116 countries in 140 languages with 120,000 people surveyed, and we've looked to increase the amount of countries for year 2. So yeah, watch this space.
Great. Now, there was a lot of information on the lack of STI scannings and testing for that. They seem to have dropped off the map from my narrow focus as a old man with a young daughter. How do we improve that, Aggie?
Yeah, that's a great question, Michael. I'm not sure we have the perfect answer for that as yet, and certainly when it comes to sexual health, there is still awkwardness around the topic for many. So I believe that the solution is definitely going to have to be multifaceted approach in generating that awareness and making people comfortable about talking about sexual health. We need to continue to improve the access of information relating to sexual health in schools and from our GPs to help people take control of their health. There are a number of great groups working on initiatives in this space, and the ACCF has recently launched a school online HPV learning system. So that's great. Jean Howes does a lot of work in helping and educating GPs about talking about sexual health in this space, as well as providing a large number of information on their website for different aspects of women's health as well, for the general public. And for us, in response to the low numbers that we saw in the survey results, we decided to launch a sexual health awareness app last year in the hope of removing, particularly for young people, that awkwardness around sexual health and sexual health testing. So the Genie app includes a risk calculator that allows the user to check if they're due for an STI check. We had frequently asked questions developed and reviewed by the Faculty of Medicine and Health at the University of Sydney. And people, if they don't feel comfortable seeing their own GP for a sexual health test, we have a clinic locator as well, where they can look up clinics in their area that do sexual health checks. So, you know, we wanted to be part of being able to help raise awareness on some of these issues and again, you know, get people back to testing.
Fantastic. And it would seem a natural add-on. We've thankfully started the conversation and push for teaching around consent and informed consent. This would seem to be a natural add-on for it, because after you consent, then you need to make sure that you're safe and healthy as a result of that consent as well.
Yes, definitely agree with that.
All right, Aggie, just to finish with, Australia scoring 64 out of 100. No nation scored more than 69. What's Australia doing well or better than most countries?
Look, I think with our healthcare system, you know, the access largely in public and private certainly helps. So, and I think the preventive programs that we have in place, trying to, you know, get people to test early and get early detection is really important. And as you'll know, we're leading the way when it comes to HPV. So that's really exciting.
Right. I read that HPV vaccine developed by an Australian, I think it was Professor Fraser, will see the elimination gone for good of cervical cancer within 10 years.
Yeah, that's incredible.
Yeah. All right, great note to finish on. Aggie Cox from Hologic, thanks so much for your time.
Thank you very much, Michael.